Hello everybody and welcome to Soul RN. My name is Meg and I will be your guide for today. Today we are going to talk about a little boy named Charlie Gard who is from the UK. Before I get started, just a small disclaimer, I am not giving any medical advice. In this video, we're just simply discussing this ethical dilemma. I am not releasing any of his medical information that was not already made public by the family. And I'm not passing any judgments on anyone's choices. We're just simply discussing whether it was right or wrong. So Charlie Gard was a little boy who was born August 4th of 2016, and he had a condition called mitochondrial DNA depletion syndrome, which causes progressive brain damage and muscle damage, and usually the child will die in infancy. There's really no approved treatment at this time, and there's no cure. So at 2 months, the family took him to a hospital in London, and he was found to have had this condition and was placed on mechanical ventilation. I don't know any further details about what happened during that hospital admission, but I know a doctor in New York, Dr. Hirano, was consulted. He's a neurologist, and he's been working with other scientists and physicians in Spain and Italy to come up with an experimental treatment for this condition. So he did suggest to try this experimental treatment at that time, but he did not come to examine Charlie even though he was invited. Maybe it was a scheduling conflict or whatever, so he did not examine Charlie at that time. So 3 months go by, now he's 5 months old, and he's starting to have seizures, which is causing some brain damage, and at this point the hospital did not want to go ahead with the experimental treatment that they had agreed to previously. They felt that it would only prolong Charlie's suffering, and it would not give him any better of a quality of life. So when he's 6 months old, the next month, the parents are still wanting to do this treatment, and so they are, fighting with the hospital. So the hospital goes to the court system in their country and asks the High Court to pass a ruling on whether or not Charlie should be treated, and that if they should override the parents' choice to treat them, and the court did side with the hospital at that time. So the parents took the case to the Court of Appeals, to the Supreme Court, and also to the European Court of Human Rights, and throughout all of those, the decision to not treat Charlie was upheld. So this experimental treatment, I don't have a whole lot of information about it. It's still in the works, and it's also way above my pay grade. But it's very experimental. There's really no guarantee, and if the MRI had shown a lot of structural irreversible brain damage, the treatment would pretty much be ineffective. And Charlie did have an MRI, and there was no structural brain damage shown on that MRI. So there's a theoretical possibility that the treatment could have helped him. They did start a GoFundMe page to try to get some support and some financial support for his treatments. They did raise £1.3 million as of April of 2017. The Vatican had released a statement about what was going on with him. They expressed their deepest sympathies, and they said that we should never act with the deliberate intention to end a human life, but that we must also accept the limits of medicine. That basically falls in line with the medical oath that you take to do no harm. Even though the family, the parents want this, and they say they want this, we took an oath to do no harm to any patient, no matter the circumstances. And we do have to accept the limits of medicine. We know we're not miracle workers, we're not magical, we just can do what we can do, and that is it. So Charlie did eventually go to be home with his family in hospice, and he did pass away on July 28th, 2017, when his mechanical ventilation was removed. And I don't blame the parents in any way for their decision to fight the courts. They felt they were doing what was best for their son, and that can no way be faulted, even though the treatment was probably not going to help him very much. There's no guarantee, and that what little bit more time they would have had with him, they might have been spent in a hospital. They might have, I know they tried to come to the US for the treatment, so they would have been away from home with no family around. They would have been stuck in a hospital, an unfamiliar place, where they were able to have him at home and be able to love him and comfort him while he was passing. So tell me what you think. Do you think that if it was your child, would you have fought tooth and nail just like the parents did, or would you have agreed with the medical ethics committee and let him go at home? This is a tough one because the child has no say, and he's not even, even if he was old enough to say, I don't want treatment or I do want treatment, there's a just, does a child really understand what treatment means? Does the family really understand what treatment means? I think a lot of families in general, not even just this particular situation, don't understand what all happens in a hospital. I don't think that families and patients even really understand what comes with mechanical ventilation, just that fact. You have a tube, you have high risk for infections. You either have it in your mouth or, through your throat. So then you have an open skin here, or you can get sores in your mouth. Dental hygiene is more difficult, obviously, because there's something in your mouth. You can get bed sores because you're laying flat or, a little raised for a long period of time. And, nurses and aides and everybody tries their best to keep these things from happening. But these things happen, and not even just those kinds of things that happen because of the treatment. The treatment may never be able to be undone. You may get put on a ventilator and never be able to come off of the ventilator. So then you need a feeding tube. So you can either get one, through your nose or your mouth, or you can get one, in your stomach from the outside. There's lots of complications that come along with tube feeding. There's just so many other things that happen behind the scenes, and I think the family is rightfully focused on their loved one and not necessarily seeing all the other things that can be happening around them to their family member, because they're just so focused on their family member recovering. So it's quantity over quality sometimes, but I think quality of life is more important than quantity. So tell me what you think down below. Thank you so much for watching. Give me a thumbs up if you like, and I will see you next week. Bye.